Having injured my shoulder recently, I had to ask the question, who do I go to see about it? At the end of the day, it is sometimes a very complex question to ask because you can go to an osteopath, a chiropractor, a massage therapist, a physiotherapist, and it becomes very difficult. In today's episode, we asked that question of sports remedial therapist Fiona Steele. She not only gave us a clear pathway to decision making, but also once you got there, what are some of the questions that you would ask any practitioner? So today I've got Fiona Steele with me, and Fiona is an amazing, really amazing. I'm serious about that because massage therapist. Fiona, just tell me, what is your specialism?
Okay, I am a remedial and sports massage therapist, but I also am an oncology massage therapist and recently qualified in scar work. So working on people's scars
Okay.
post-surgery.
So there's three things I think people need to know first. So we've talked about massage therapists. So I think a lot of people actually have this kind of weird idea of what is a massage therapist to start with. So maybe we could dial back a little bit and just tell me, what exactly is a massage therapist?
Okay, a massage therapist basically works on soft tissues, i.e. manipulates, like the skin, the muscles, all of those sort of things. So if you're a bit sore or if you're stiff, people tend to think, oh, massage. And, you might get family or friends that, when you've got tight shoulders, they kind of do this. That's basically what a massage therapist does. And you've got different types of massage therapists. So a lot of people that if they have had a massage, it'll probably be on holiday with a sort of a spa massage. So they go and it's very relaxing. There's nothing wrong with them, but they come out feeling, so that's one type of therapist. Then you have things like people have like a Swedish massage therapist. So there's certain techniques that they employ. They know a little bit more about anatomy and physiology. And so they will use that knowledge to do that. Then you get on a little bit further onto your remedial and sports massage therapist. So if you have an injury, you've maybe been down at the gym and you've pulled a muscle, that kind of thing, then you would possibly go to a remedial and sports massage therapist who would kind of put you through a range of motion tests. They would ask you to perform certain, movements and find out specifically what muscles would be involved, where the problem might lie. And so then they would employ certain techniques and certain stretches, passive mobilizations to try and remedy that and also relax you and things like that.
Okay, so the relaxation is almost like a side effect, or it's part of the whole
package. It's part of the whole package, okay. Yes.
So if we remedial sports massage, okay. So I know I've come to you and I said, I've injured my shoulder here, and I think it's an impingement. Okay. And you said to me,
right, well, the first thing is, that's more of an injury than, oh, I've got, like I feel a little bit tight in my shoulders. So, it's a bit more, right, okay, there could be an injury here. If there is something like that, I would usually say, have you been to your GP?
Yeah.
Because they are usually, with something like that, your first sort of port of call to find out that there's nothing, life-threatening or that could cause you further problems. So they might say, oh, just rest it for a few days, keep moving, but rest. and, certainly don't do, the thing that caused it in the first place. Or, just you remember when you're, going shopping, don't be lifting heavy bags, things like that. And it will probably go away, because usually these type of injuries, eventually the body heals itself.
Yeah.
If they're thinking that you might need a bit more intervention, they might say, okay, we're going to send you to the physio, or we're going to ask you to phone up for an appointment with the physio. And then you either go into the NHS system where you wait for your appointment, they will send you an appointment, or you can go down the private route. So you contact a private physiotherapist, and then they would do what they do.
Okay, so I know a lot of people are thinking, well, you talked about physiotherapy. We started with massage and sports remedial, and then I think I heard something about osteopaths and
chiropractors, and yes.
How am I meant to navigate all of this sort of space?
Okay. Well, I think first of all, your GP will kind of point you into the right direction, but also will reassure you that it's probably going to get better. However, we're talking about maybe, if depending on who you see, we can be talking about weeks, months, and all the rest of it. Meanwhile, you're sore. So
I've still got the pain.
You've still got the pain. And you might not want to be, taking lots of, painkillers, which, you don't want to. So the first thing that you can do is make sure that you're keeping yourself well. So hydration, sleeping well, eating well, moving, still going about. What you don't want to do is not use it. So you don't want to be, I've got a sore shoulder, so don't anyone come here, I'm not going to use this. No, do your general movement, brush your teeth. Now, if there is a particular...
Brush my teeth?
Yeah, brush your teeth. It's a good movement, there's comb your hair, all of those sort of things, general movement. But if there's a certain movement, like maybe, putting on certain clothing, actually that's sore, then don't do it. Because if you've just recently injured it, you want to rest it as well. So that's what you can do. Now, if you're thinking, I am not going to be sitting here with this sore shoulder for the next, 3 months, then what you can do is you can go down the private route. So then you'd be looking at going, do I go to a chiro? Do I go to a physio? Do I go to a massage therapist? And then what type? Or an osteopath and things. Well, it depends on what's wrong, which route. If you want to go straight to the top of the food chain, go to a physio, because they will put you through a range of motion tests. They know anatomy, they know physiology, they will have a look, they will give you sort of stretching exercises to do, which will help the healing process. And also eventually those will turn into strengthening exercises, because once you stop using, particular muscles, you get like muscle wastage. Now, that doesn't mean that your muscles disappear. It just means it loses its tone. It loses, that kind of, firm. So it gets a bit flabby and things when you don't use it. So that, you could go straight to a physio. You could pick any sort of physio in your area. Obviously, if you get recommendations, go with that, that one. However, most physios are great because they are regulated, which means that they pay a lot of money to be part of
a registered,
group. So that they've been properly qualified, and they've done so many hours experience before they've been let loose on the general public. Then, okay, so you maybe not want to go down that route, or then there's not a physio near you, or again, it's going to be too long to wait. So you think, okay, well, what about a massage therapist? Now, you could go to your local beauty salon, and you would get like a massage that would relax everything else, and that would help. Or you think, okay, I need something a bit more specific. So you would go to maybe like a Swedish massage therapist, or maybe even go to a chiro, because although that they'd be manipulating the sort of the bones, quite often in clinics, they'll have a massage therapist on site. So they might even say, oh, make an appointment with our massage therapist as well. Now, also, you've got to factor into that the cost.
The cost, yeah.
So, okay, so you think, okay, no, I just want to see, you know, a massage therapist. Okay, so you say, right, I'll go and see a sports remedial massage therapist. Well, depending on if it's a bit of a sore shoulder. Now, if you've probably done it at the gym and things like that, then you probably go to, you know, a sports. Quite often gyms have sports therapists on site as well, and they would be used to those type of injuries and know, you know, what to do, and they'd be able to give you, once again, stretches and also strengthening exercises if they're you know, like PTs and things like that.
Can I just clarify with you a minute? So there seems to be a common thread about stretching and strengthening.
Yes.
Okay, so either physio or chiropractor or remedial massage therapist, all are using or would be talking about stretching and strengthening exercise
after certain periods of time. So you want the injury to heal. You want to do so. It's just like general movement. But then once the injury's healing and you want to help it along a little bit, then you do, because you don't want to lose any range of movement. You want to still be able to do the full range of movement. So you start incorporating more stretching, and they will give you specific stretches that will help that and not hinder that. And then eventually, once you're able to do all of these stretches the way you could before, then you would want to maybe build and stretch, you know, build the strength back into the muscles. So then you would start doing maybe more reps with a bit more, you know, a bit more sort of, you know, intent in a way. Then you put in some resistance, so like your weights around your wrists, or, you know, holding bottles of water, and, you know, you'd slowly build up that strength.
I remember when I used to read Men's Health many years ago as a teenager, and they used to talk about this thing, what was it, eccentric and concentric and all of this sort of stuff. And I'm thinking, but when you did it with me, we did, so just I'll borrow your hand a minute.
No, okay, that's
and that sort of, that is like a stretch, isn't it? So you're calling this a stretch.
Yeah.
And in my head, I'm thinking, is that the same as an eccentric?
Oh, all of those. You don't need to bother about that.
I don't need to bother about
you
all
don't
of
need
these
to bother
things.
about that. It's just, it's a bit of a resistance,
you
know.
Or somebody else might say, oh, so that's isometric, isn't it? And all this sort of stuff that gets into your heads.
Your therapist won't tell you about that unless you want to know. Then they will. What they will tell you is what you can do in the office, at home, and it'll be something that you'll be able to do easily. And they'll tell you why. They might, if you ask, tell you what muscles that you're working on when you're doing those things. But not necessarily, because at the end of the day, what you want to know is not the anatomy. You want to know, how can I improve my sore shoulder? How can I get better? So, you know, just like when you go to your GP, he doesn't go through all the physiological, you know, things or anything like that.
What's the nitty gritty? I'm not interested in that. I just want to feel better.
Yeah.
So let me back up a minute again. In my understanding, a chiropractor is the bone man.
Yes, he's the bone man.
The massage therapist is the muscle man.
The muscle man. Yeah, because it's basic. If you want to put it down to that, because then you think, right, you know.
Okay. Mm-hmm. So I've injured, well, let's say I move on to my back somewhere. There's something, I got this pain between the shoulder blades. And you're saying, well, I can either, we've done the GP. Okay, we're on to the next step. Do I go to the chiropractor or do I go to the massage person?
Well, I would probably go to...
Well, you are biased, I know that.
I am.
But
the remedial sports massage therapists, because they will be able to tell, because they do some tests as well that can say, hey, I'm wondering that this might be, because they will refer you back. They might think, oh, I'm not so sure how much of a muscle problem this is. I think it could be a structural problem, i.e. it could be something more to do with the bones, or you want to be realigning your spine. In other words, you want to get back into that nice straight position. Right. So maybe your chiro would do that. And it's the same with the chiro. If he says, yeah, we could be doing with sort of getting your spine back into a nice straight line, that would help with your back problems, but actually you're so tight and you're so holding yourself like this, maybe a session with a massage therapist just to loosen that off, and we'll be able to straighten you.
So here's where me as Joe Public am going. So you're saying this piece is a bit concerning, because how do I know that the chiropractor is going to go, maybe you could do it a bit of a massage, or the massage therapist who's similarly going to go, maybe there's an alignment or structure. How am I navigating that?
Okay, yes, because this is where it does get because unfortunately, unlike physiotherapists, the massage industry is not regulated. So in other words, what that means is that somebody that can call themselves a remedial and sports massage therapist, they have done possibly, like 2 years of training with like 60 case studies. They've had qualified people watching them, teaching them, all the rest of it. That's fine. That's what you're kind of expecting.
Yeah.
However, somebody that has done a weekend course, and somebody even that's just been online.
You mean YouTube?
Can say, hey, I'm a massage therapist, and set themselves up in business as that. Now, you want to go to the person that's had more experience, more qualified, all the rest of it, because you will be safer.
Yes.
Because, there's not many people have died on the massage table. However, you can certainly make things an awful lot worse. Yes. And you don't want to be increasing your pain. You want to be decreasing the pain.
So here's the thing, Fiona. My mate next door, Dave, said to me, he went to this massage therapist and it was great. And I go along, with my sore shoulder. Now, am I going to get what Dave got? Because this is I think this is kind of like the problem with people say, oh yeah, you just get a good recommendation, but I don't know what was wrong with Dave to start with.
Exactly.
Except he had a nice experience.
Yeah.
And so he's starting to recommend his mate, down the road to me.
Yeah.
How do I navigate that sort of stuff?
Well, because it's more of an injury, you'd want to go to a remedial sports massage therapist or a sports remedial massage therapist. It's interchangeable. You want somebody that's used to diagnosing where the problem area is, because sometimes, for example, like sore back, low back pain, lots of people experience low back pain. Doesn't necessarily mean that the problem is stemming from your lower back. It could even be up in your shoulders. Well, a remedial sports therapist will be able to work their way through that to find out where the root of the problem is, or be sufficiently to say, hey, I think we should refer you to such and such if you haven't already been.
Got it.
But you need to know, well, how do you know that they're good? That they haven't just done a weekend course?
Yeah.
Well, you need to ask certain questions. So first of all, you can say, oh, how long have you been doing this?
Yes.
That's okay.
A good one. Yeah.
Then you say, so what are you qualified in? Now, they will give you lots of qualifications, and they will give you all these, it's recognised by the blah-de-blah-de-blah-de-blah.
Yes.
What does that mean to you? What does it mean to anybody? So then you have to narrow it down further. You might say, are you accredited by a university? For example, our school, we're accredited by a university, which means you can go on to do physiotherapy, things like that. So, that would say, well, they have to go through a certain rigorous, exam process. So then you could say, okay, did you, did you study just online? Or was it a combination of online and, physical? Did you watch people? Were you in the room? Did you have hands-on experience before you got your qualification?
I think this is really important.
Yes. Now, this is that. Now, for example, for like our Swedish, because I'm also a therapist, I'm one of the therapists for our massage school. So when we do our, Swedish, they have to be qualified in Swedish massage before they go on to do remedial sports.
Right.
So in our Swedish, we have the last few months of the course, we have what we call case studies. So the students go out, they find people that they can massage, and they write it up as if they were treating people out in the real world.
Yeah.
We then mark it. We were watching them in this, during the school. We have afternoons where we come round, we watch, we help. They see demonstrations, because it's a physical skill. You need to have hands-on experience. It's not the same watching it on YouTube, watching it, on Zoom or something.
Because the camera directs you.
Yes, exactly.
So that piece is important, because the thing is that there's a reflective piece on this.
Yes.
What did I do? Can I do it better? What will I do next time?
Exactly.
All of this sort of stuff. So it sounds fairly complicated, but it's really important to not just go by, oh yeah, so-and-so says I went there and it was wonderful.
Yeah, because it depends on what you're going for. And there's different things. So if you ask all of these questions, and ask them before, because they should do a consultation.
Right.
Sort of. Now, ours is very in depth. Some people don't go as in depth as we do, but they basically ask, how did you injure? What do you know? So you can ask them that. Do you do a consultation period? What do you what would I expect to happen? Because part of our consultation, that I would do is I then say, this is how I would treat you before we treat you.
Before you put your hands
before I even get near you. I say, right, I think, we've got this problem with your shoulder. I think this is what I would do. And, and if you're happy with that, by the sounds of it, then you say, yes, I'm happy, and we get you to sign it.
Okay.
So it's an agreement between the two of us. Now, if people, I know that some maybe beauty salons don't tend to do that, because what they're providing you might not necessarily need. But if you're going in with some sort of pain and injury, then I would want to make sure that somebody was doing that.
Yeah.
And also, ask them, do you have insurance?
Yes.
Things like that. All of those questions, because if you are a serious therapist, you will be insured. You will go through the consultation you will be able to, talk to your client about what you feel's going on.
Yeah, well, that's really interesting. I think that's important to work through the process of getting to that point. And I think for us now, within the NHS, there is a huge gap, because there aren't enough GPs to start with.
Exactly.
And then the GPs may not be able to refer. And I think what you said is that sometimes they can't refer to a massage therapist because it's an unregulated space.
It's unregulated, and they can't be seen to be favouring. They can't say, oh, I know Fiona that does sports remedial down the road, go to her. They can't say that. Right. So they can't really recommend. You might get a GP that says, well, until your physio appointment comes through, you might consider, going swimming, go for a massage, things like that. Yeah. But, GPs have to be very careful as well.
Yes.
What, what they're recommending. So they might not say that. So.
Yeah. And I think that's part of the problem, until we can find a way of pointing, and this is why we're recording this. This is a pointing way. This is not how to do massage. This is not who to go to.
No.
This is, here's the process.
Yeah.
Which will
How
help.
would you go about finding
Yeah.
one that suits you?
Yeah.
And then at the end of the day, you know, if you have a good experience, you can say, great. And if somebody says, oh, do you know a massage therapist? Then you can say, well, when I had this problem,
yeah.
I went to such and such, you know,
Yeah.
and then the person can make up their mind. Or they might say, well, how did you find out? What did you ask? And then you can...
It's a bit like buying a car, isn't it? So if you go in and you buy a car and you think, oh, that's wonder, I went to this garage and I got this great deal, and I came out there and I was really happy. And so I go in there and I say, hold on. So I was looking for a Skoda, but you're trying to sell me a BMW.
Exactly.
Or I have, you know, £1,000. What can you give me? Or you had £1,000 and you got something you're really happy with. And so I guess this is the thing with this is, what is the expectation?
Yes.
What is the circumstance? You can't just go with a, like, one size fits all.
No, exactly.
And I think it's really important for anyone doing this to say, how are you choosing? And the choosing, the process of choosing is important.
And then once you are there, do you feel safe?
Yeah.
That's the next thing. Once if you've decided, oh, I'm going to see such and such, when you go in, do you feel safe? Because the minute you walk into the door, a properly qualified therapist will make you feel safe from the minute you get in, right through the treatment to the minute you get out. That's physical safety, you know, emotional safety, psychological safety, all of those things. And that's also when you know you have, you know, a properly qualified therapist.
Thank you. Fiona, I've got a question for you.
Oh, no.
Man, Fiona, I can't afford a massage therapist. I like going to the gym. Can I use one of these instead?
Well, you know, did somebody recommend? Did your PT recommend that?
I don't know, but I found it on YouTube, and it was only £11. Come on.
Well, it's once again, you know, what YouTube video were you watching that recommended it? You know, are they, you know, have you seen lots of things by them? Have you tried other things that they've recommended and it's worked? Because once again, you've got to be careful. If you don't know what you're doing, you know, you don't know what position you're in, you could actually aggravate something or cause another problem.
Well, let me drill down a little more. So when I go on my little runs, okay, a little meaning up to 5K, I get the soreness along my IT band.
Okay, yeah.
And Runner's World told me, you need one of these to solve your IT band problems. Is there anything wrong with that?
Well, you have to say, are they making a profit by telling you you need this to solve your IT problem?
Only if they give you the top 10 and this was in number 1.
That's, yeah. Well, once again, you know, I mean, you could try it, but then it's some more money. And that's even more kind of, you know, like, oh, crikey, I saw something on the internet that they said. And once again, when you don't know exactly the problem, and do you know, why do you know it's your band? Why do you know it's your IT track that's, you know, giving you a problem? You know, it might not be there. So, yeah. I mean, if it does make you feel better after your run, you're not injured, it makes you feel better, then, yeah, knock yourself out with it.
Thank you. Fiona, do you have a view on things like Theragun, those percussion things that go boom, boom, boom? Now, I have no injury, okay?
Yeah.
I have no injury. But again, the Runner's World and the Men's Health and all this sort of stuff are going, oh, yeah, you need a percussion boom, 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 boom. And it has 6 different speeds. And it's got 12 different attachments.
Yeah, well, personally, in my opinion, for me, I wouldn't say that you need that. If it works for you, and then fine. And if you want to pay that money, then fine, but don't feel you need to do that. Now, as a massage therapist, I don't use tools. These are the tools that I use. So I prefer to use that rather than all the gadgets. But sometimes some people, they like that whole package.
Yeah.
And if that makes you feel good, that you feel, oh, this is, keeping me really well and healthy, and that suits you, then fine. It's not causing you any problems. Then go ahead, get all the gadgets and use them and be well with it.
Okay. So as Joe Public, okay, my question is, do these things work? Do you have any kind of knowledge of, do I use a percussion gun to release my muscle spasm, my muscle knots? Do they work?
Yeah, well, I mean, some of these reviews say they do, and all the rest of it. And I suppose it depends on where you're looking to find that out. What evidence base are you looking at to see? Well, this works. You're not just saying, like buy this. There is actually some evidence for it. And if it is a properly used, and it's used in a lot of different sports and things by different, coaches or whatever, or physios, then yes, there will be the evidence to back it up.
Yeah.
So if you want to go down that route, you can. It's once again, it's finding out, the information before you just go ahead.
Yeah.
And go into something like that.
Well, I know most guys are into their gadgets.
Yeah, well, exactly. So
even if it works or it doesn't work, because it's a gadget, we tend to buy these things and then put it in the drawer.
Yes, that's So no harm done.
No harm. And by the way, I don't have a collection of percussion guns. In fact, I don't have any at all. But it's useful to know these things, as to say, right, okay, you might be doing it not because of any sort of research, or not because everybody's using it. So, all right.
Yeah. Find out before you go to anybody or buy anything. Find out about where you're going or what you're buying. Do the research.
Otherwise, you're just making a company a lot of profit. Yeah. Fiona, it's been great. It's been really interesting.
Well, I've enjoyed it, Johnson. Thank you.
Good. You're welcome. And we no doubt will see you again soon.
Definitely.
Okay.